question.
Oh, yeah.
Yes, ma'am.
Yeah, Dr.
Hello.
Padmaja. Yeah.
Yeah. Hello, Dr.
Hi.
Kalpavalli.
Nice
I
meeting
think
you.
we have,
Hello.
we have met many times
We
before
met
also.
early.
Yeah.
Yes, ma'am.
I just wanted to have a clarification for all the other,
Yes.
including me. What is the higher susceptibility?
Ma'am, actually, sure. I would like to give a clarity on the higher susceptibility, lower susceptibility. Actually, there are certain criteria which are explained by Stuart Close that the factors like age, the factors like the work,
No,
they all influence your susceptibility.
My question is, I know about susceptibility, I got understand. Higher susceptibility, higher potency means what? Higher potency means what? Is it 1M, 10M, 200, 30? What is that higher potency? What does that word indicate?
Ma'am, actually the thing is like there is nothing specific like 1M, 10M, 50M is the higher potency and 36 are the lower potency. What I have understood from the teaching of organon, that at times 6 potency would be the higher potency for the person. Okay, because the person
then what is the lower potency for that person? What is the lower potency for that person?
Actually, ma'am, this I too have a doubt, and I have referred lot of books, and wherever I have referred the books, they told that the seat of the disease will guide you for the selection of the remedy. There's higher
selection of the
lower
potency.
Yes.
What I want to add here is, madam, excuse me. What I want to add here is, the higher the susceptibility means. This is my doubt actually. See, the person is completely to the. You said that the PQRS are there and completely all symptoms are indicating to one simillimum. Then you said to be given higher potency. You mentioned that at that time we need to give higher potency. Higher potency is commonly indicates that 1M, 10M, 50M, something like that, right?
Yes. That is in our general understanding.
But what we learnt in college is higher potencies means 30, 200, 1M are the higher potencies, 10M, 50M, 30 they are the lower potencies. Something like that we have learned, and they have explained one theory for that also. That we will speak about afterwards. But what I want to ask is, already the patient is nearer to the simillimum. That is, the necessity of sensitizing him is very, very minimum. Right?
Yes, ma'am.
If you just prick him with a pin also, the balloon will blast, right? So at that time, why would we give 1M or 10M or something like that? Why can't we choose some optimal potency? That means 6 and 30 are very low. Maybe they produce the pathological, the crude symptoms also. And 1M, 10M are very little high. Maybe they produce the mind symptoms also. So the optimal potency is 200. So some people theory will be like this. So why won't we choose the optimal potency and that to minimum dosage?
Ma'am, actually,
may I have one my thought on this? It's a very important point actually. It comes up again and again in each cases, especially in cases like autism and heart attack are such a very crucial cases. And I think Vithal's guidance in this regard will be very helpful. Levels of health. So whatever Dr. Padmaja is telling, that is very important. In higher levels of health, that is A group, that only pin prick is enough for them to start that process of cure. Okay.
Yes,
but in 10, 9, 10 and lower cases, there even 6x will be very high potency.
Yes,
so
exactly.
I will beg you to go and study levels of health. That will be very, very helpful in our practice. And even on autism, when it is based on mental symptoms purely, and their susceptibility will be very high, like their reaction will be very high, but susceptibility will be very low. Like they react very intensely. Very, very big turmoil will be there, whatever homeopathy medicines. But they will have very less remedy. They don't give the results what we expect from the remedy. So that reaction and reactability, those two things are different, susceptibility and reactability. So, but autism cases, 10M single doses have been curative.
Ma'am,
It's a few
what
cases. That is because
yeah.
of they are in the higher levels of health. So,
Hmm.
so I will ask you to just check in this regard. Higher levels
Ah,
of health, they respond very well to higher potencies, whatever we are
okay.
talking about. And
Okay.
lower
Ma-
levels of health, even
Exactly,
though
madam. Exactly. Yeah,
that
exactly.
is very minimum stimulus, they can't handle it. Yeah, this is my point of view. Yeah.
Yeah.
Yes, we
Yes,
have no
madam.
few
Yes. So,
questions from Dr. Pavani
conclude. Okay,
before
madam.
we
So I
end.
will give the conclusion to the question which I have raised now, so that there will be no confusion to all the audience. So I will give a conclusion of the question or the concept which I have raised now. See, what you have said is higher susceptibility and higher medicine. That is quite true also. That quite true. But here, whenever I said that one pinprick is sufficient, yes, that pinprick is sufficient only. But that pinprick indicates the number of doses, but not the potency of the dose. Right, madam? The number of doses. Like, if that 10 m is the seat of the disease, 10 m, one dose is the pinprick. Okay?
Yes.
If that 1 m is the seat of the disease, 1 m may be one dose or three doses may be the pinprick of the disease.
Yes.
So that means
yes.
minimum initiation is sufficient, but what is that minimum? What is that minimum dose? That we need to decide, madam. That is the posology. That is where posology will come. And some cases, only in my experience, past 30 years, in some cases, that means only 20 to 30% of cases depend on posology, madam. Baki 70% of cases depend on the selection of the remedy itself. So whichever potency we use, generally, it will produce results only. Like that, madam. That is the truth. That is the reality. Absolute reality is that one. That is why many of us are using potencies in different, or they are misusing also like that. So we need to have clarity in that one. Ho sake to, or I mean, if possible, you can add something on this in future clarifications, madam. Thank you. Thank you.
Thank you, ma'am. Thank you.
Hello, Dr. Alka and Dr. Kalpavalli. Can I add my insights into it?
Yeah, sure, ma'am, sure. With all pleasure, you can add your.
Thank you so much. Yeah, Dr. Kalpavalli has raised a very nice point in her PPT, aphorism number 30 to 32.
Yes.
And aphorism 32 says medicine works unconditionally.
Yes.
Could you please elaborate? Then I will share my insight as well. Dr. Kalpavalli.
Yes, ma'am. Here, medicines act unconditionally. The reason what Dr. Hahnemann says is that because the dose and the potency are under our control. For a disease to act, it should have all the environment and the favorable conditions. That the person who is getting infected should be ready to take the infection. Whereas the drugs we can give to any person, and the drugs will have their effect upon the body of the individual, whether we appreciate it or not. But still, we can observe the change of the action of the drugs. That is what we have learned in drug proving. So Dr. Hahnemann says that the drugs are under the control of the physician. See, if a particular drug have not acted at a particular potency, like maybe, for example, in drug proving, usually we say you have to go with increasing doses of the medicine to understand the characteristic symptoms of the particular drug which produces. So they say you start with 6, 30, 200 likewise, and then as the potency increases, you will be able to see with the more characteristic symptoms. That's what we learn in drug proving. Now, when the same drugs are given, we will give the more the characteristic symptoms are there, the best drug can be selected in the higher potency. So, for which he says drugs act unconditionally. So, if I'm
fantastic inputs by you, Dr. Kalpavalli, and I would like to add a practical approach to it. Say, all the persons, there are TB, okay, this Cox organisms are there in the environment. Not everybody is suffering, only those who are susceptible, okay, they will be having Cox, isn't it? The healthy individual will not have, because they are not susceptible to it, right?
Yes.
So, when we say medicine works unconditionally, as per aphorism number 32, medicine when we give to a kid or to an old age person, it will work.
Yes.
Medicine का काम है work करने का. But in case of disease, only those who are susceptible will be suffering from cough. A very important point to be marked.
Yes.
So, when it comes to stamp vitality sags, it will be low potency. And the medium potency would be for those people who are not having the grave pathology, and those who are not giving much mental, we can go in for the medium potency, that is 200, and low is around 30, higher is 1 m and 10 m. So according to the case, the susceptibility, the patient's age, various factors will consider the potency. Yes, Hadiman sir during his lifetime has given some insight into postology, but after all it is individualization and case study. Many debates going on in regards to postology. Ma'am, why this, why not this? But it is the discretion of the physician who is in the seat sitting there, and it is for him or her to decide accordingly. Hope this helps out. Thank you so much, Dr. Alpha.
Yes,
for,
exactly.
And Dr. Kalpavalli, Dr. Vaishali, you are doing a good job by gathering all the homeopaths here with. All the very best to everyone, and keep shining. Thank you so much.
Thank you, Dr. Raksha.
Thank you, Dr. Raksha, ma'am.
Your ideas were really good pointers, but we have few more speakers who are, or rather participants who want to put in their queries. Dr. Pavani T has messaged.
Sorry for not keeping my videos on, but my mom has just recently been operated for knee surgery, plus cataract also was done earlier. She can't bear the sharp light. Okay, so dim light is there, so I not put my videos on. Okay, but my best wishes are always with you all.
Thank you so much, ma'am. Thank you.
Yes, is there anyone else who would like to ask a question? Yes, Dr. Vaijayanti Nagarkar, she wants to ask some question. Yes, ma'am, please.
Hello, Dr. Kalpavalli, everybody who have your cameras on.
Hi, ma'am.
Thank you for all your slides and everything. There are two things I want to ask. One is, what have been your practical difficulties? You can hear me?
Yeah, ma'am, I couldn't hear you properly. There is some disturbance in the continuation of the voice.
I said there are two types of questions, two queries.
Yeah, ma'am. Yeah.
One, I want to know, did you face any kind of practical difficulties during your tenure or your practice of application of organon in day-to-day practice? This is number one. But say when you select a particular potency, whether it's 30 or 200 or 1 m, patient, let's give you a common example. Supposing there's a patient who's having pulsatilla symptoms and we prescribe her 30. Okay. So how many times will you prescribe 30 whenever she gets any kind of an acute? When you come to a particular stand that this potency has exhausted, now I need to move on to the next potency, and how long will you keep on enhancing the potencies till what level, and what are each particular 10 m, 50 m, cm potency for the same patient with similar complaints, say of pulsatilla?
Ma'am, actually, I would first like to answer your question number 2, because once I had a patient, she was 28-year-old. She complained of joint pains, multiple joint pains, and just give me a minute. If I have that case, I will just try to show it on. That case, actually, she presented with a scanty menstrual bleeding. Okay, and that she told upon inquiry of the entire case, but she approached me for her joint complaints. And before she came to me, she was already using the Pregabalin. She is on Pregabalin. Hope every one of us know what the action of the Pregabalin is. So when she have approached me and I have inquired the case completely, she told that the complaint started after her brother's death, who was alcohol addicted. He died. He met with an accident and he died. Even though he is an alcohol addicted, after that she has to take care of her entire family, father, mother, everyone, who were depressed of that sudden incident where he met with an accident and he expired suddenly, even though he is drug dependent. So that has impacted her, where she couldn't share her grief with any of the family members. that she had a close contact, I mean, close relationship with her brother. So what I did was, like, after taking her case entirely, I have prescribed her with Ignitia. And initially I prescribed with Ignitia 200. The next time when she have come up, she told me that she's not better at all, and her complaints were not at all reduced. Her joint pains continued, and there was relief of the complaints because she is on Pregabalin. Okay. So what I did is, like, when I have understood the case again, and when I have inquired about all her signs and symptoms, she said that the symptoms continued like that. There is no change in the symptoms. So what I did is, like, next visit I gave her Ignitia 1M, because I felt Ignitia 200 was not sufficient to her. When I have prescribed in the next visit, after giving Ignitia 1M, 3 doses I have given her. And I asked her, the moment you feel better or there is increase in the symptoms, stop the repetition of the medicine. This is the common instruction I give the patients. So after giving Ignitia 1M, she was taking earlier Pregabalin every day. The next visit after she have come to me after a month, when I inquired her, she told me that she reduced the intake of Pregabalin. Okay, so there was a considerable relief in her signs and symptoms, that she started doing her regular activities and all. So I felt that as she found some improvement, I just maintained her on SL for almost 6 months, ma'am, after giving Ignitia 1M. Then she came back telling that her scanty menstruation have continued, but the intensity of the complaints have reduced. All the other joint pains and everything was reduced. So I told her to go for a gynec examination for her scanty menstrual bleeding, where almost all her tests were normal. So I have not changed my remedy, and I just continued her on SL for another 3 more months. So this is how I understood, like, when there is this is my practical understanding of the case.
So supposing if there comes a chance, like after 1 year, 2 years, or whatever, if you have to give her Ignitia, 50M, and CM, all right. After this potency, what will you do? How will you go ahead? If she still needs, yeah.
Ma'am, actually, in my entire practice of this almost 17 years, to be frank, I have never prescribed CM. Majority of the cases, they were relieved after 1M or 10M. And in cases of acute conditions, what I usually do in my practice is to frequently repeat, and to give the immediate relief, I ask them to go with water doses. I ask them to just repeat the medicine frequently, so that the water dose can reduce the duration of that action of the remedy, and it enhances the action of the remedy. Likewise, my prescription will just go on, and the person will feel relief. This is what I followed. Like,
for example, if somebody with a joint pain comes, and if you are giving the person Rustox, you will give for some days. As the person is feeling better, you will withdraw, stop for some days, correct?
yeah, no, it's not like I withdraw immediately. I will just maintain him. I will reduce the frequency of the repetition. As the person feels better, I will slowly stop the medicine in due course of time.
After 5-6 months, he comes back again with joint pains. You will start with the same potency, same repetition.
Yes, ma'am. Because that potency have acted for 5 to 6 months, I will repeat the same potency, considering all the other factors which have triggered him.
If he comes with the similar symptoms after about a year, 1.5 years, then will you increase the potency? You will continue.
Then I will just check over, ma'am. If first I'll start with the same potency, because that has taken, that has given a relief. If that is not giving any relief and he's coming back, then I will enhance the potency and give. In one case of osteoarthritis, where I have to enhance the potency within 2 months, because the earlier medicine was no longer acting and the person had complaints continued. So I had to change the potency very frequently in the person.
There are two aspects. If you feel that the person is not responding to the existing medicine, that means the medicine will have to change. But if he has responding to the existing medicine, then what is the criteria that we will now increase the potency? Because his susceptibility to the disease has reduced and his immunity has increased, so his sensitivity is better.
Yeah, his sensitivity to that particular dose, it is exhausted, and he is no longer reacting to the particular potency. So that's why he is suffering with. So in that case, I need to enhance the potency and give.
Yeah, same context I was asking that they might come a day when you have to go to 10 m, 50 m, cm, and then what after that? That's what I mean. In organon, have you done kind of
Ma'am, then I need to check why that medicine is not acting. If I have to give an intercurrent remedy, I have to give an intercurrent remedy to again initiate the action of the previous well indicated remedy. So intercurrent remedy takes that role that this particular remedy has stopped working, or maybe there is a condition where it is no longer showing its effect. Then I have to interfere certainly with the intercurrent remedy. Then intercurrent, after giving the intercurrent remedy, I might require the same potency to be repeated, because it has a longer action where the person suffering is reduced for much longer period. So intercurrent remedy might.
There have been homeopaths, who said or you believe that after reaching a particular target potency, they'll go back to 30 potency. That's what in terms of organon, I wanted to know what was the experience in terms
Ma'am, actually speaking, after reaching to a higher potency, maybe the susceptibility of the individual would have reduced so much, or maybe the suffering of the individual would have come to the lower level. Then if the disease has taken a hold and the person have been better for much longer time, then the susceptibility would have been in a very lower level. Then we can give, but I don't know whether we can. But it is already, I mean, there I have read in somewhere that if you give smaller potency after you have administered higher potency, this might antidote the effect of the earlier one. But this I have not noticed anywhere in my practice, to be frank. So mostly we'll have to go with the intercurrent remedy and then prescribe the same potency as far as what I do in my practice. Ma'am, hopefully I have addressed. Hello, ma'am?
I suppose there is some internet problem, so it's not audible.
hear me?
Yes, now you are audible.
One more question. Can you hear me?
Yes, ma'am. Now I can hear you. Yeah.
So you are answered the second question. What was the first question? I also forgot. Sorry.
Ma'am, you asked me like whether I have seen any cases where regarding this practical application of organon in my day-to-day practice.
No, practical difficulties. Yes. Did you find that we are definitely studying all these things in the organon of medicine, but have there been really some practical difficulties? Why?
Ma'am, regarding the practical difficulties, the most difficult thing what I understood is like administration, like what we suggest to the person regarding the dose or how much amount of the medicine potency is what we decide and give. But regarding the administration, there is a lot of difficulties which I have noticed that the patient comes and tells you that I forgot to take, or I have not done this, I have done this. So the interfere in between. Many a times it is like people come and ask me whether I can take green tea. I am habituated to take green tea. These are all the practical difficulties which I understood from the point of the patient, and from my point is like one funny incident, like somebody have come and asked me medicine for some acidity, and the person is alcoholic. I asked him to stop alcohol so that the acidity will reduce, and then he immediately asked me, shall I take it once a week? So such type of funny questions are like many a times difficult to answer, but people knowingly they ask, and mostly is with the administration, ma'am, which I observed. What we read in organon and regarding the administration, that is the most practical difficulty which I understood.
So
in my entire
part, are there better results with the pills, or are there better results with the diluted in water, or what?
Ma'am, in acute cases, this dilute, like as I told you, the water dose have given instantaneous relief, whereas pills also have worked well. But to be frank, many people, they have a habit of taking the medicine directly, and they say initial dose what we take is little stronger, and we get the feel of taking the medicine as the days pass on. It is just like the sweet pills, the sugar coated tablets that we are taking. That is one what they say. But when I convince them that the medicine, once it is prepared, it is there for longer time, many people have understood, and that difficulty is little reduced.
Unfortunately, there is a non-standardization in the way of administration of medicines also which doctors follow, no?
Yes, ma'am, that's exactly.
I would like to say something if I'm allowed, Dr. Nagarkar. May I speak something regarding the water doses?
Yes, ma'am, please continue.
Dr. Kalpavalli, may I?
Yeah, ma'am, yes, please. You all can add your valuable suggestions.
Thank you so much. I agree water doses work much better in acute cases. We had a professor who had, I actually follow both of them, who had two ways of giving the water doses. One, it's like you mix 3 pills in 1 cup of water, give 2 teaspoons, and after that you replace the 2 teaspoons with another water, okay? And so you give 3 times a day or 4 times a day. Every time you give 2 teaspoons, you replace that quantity. So this was one method, and there was a second method that every time you give 2 teaspoons, you don't replace that quantity. And we found in both, whenever they were replacing the quantity, the results were better, which means the water that remained in the cup at the end of one day was same what we started with. So the way he explained to us was this was actually our succussion, where we kind of will give strokes to increase the potency, keeping the quantity same. So that is how the potency increases. So there are two ways of doing this. One is where you don't let the quantity reduce, and in such cases it works much better. Has anyone had similar experiences?
No, I have some funny experiences. Like some of my relatives might prescribe, they'll buy medicines from outside, and there's a nozzle, right? So they just touch one drop. And I say, "Oh my God, you've taken that one drop." So he said, "Yeah, that works fine. So that's okay for me." I said, "No, no, you put this in the pill." No, 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 I'll take it like this. This is a very funny. They feel this is working better. Why should I do it?
Actually, ma'am, this is a quite common thing with many of the people. Like in some emergencies, we ask them to buy the medicines, and they'll buy the dilution directly, and they say that we use one entire drop of dilution for our dose. And many a times, people, when we ask them to go with the pills, they just take some 8 to 10 pills, and maybe if 2 to 3 pills they take, if they have been taken and the rest all left over in the lid, again they take that, they are telling that you told us to take 8 to 10 pills and we have taken only 3 pills, so remaining also I have to take. That is what they usually does. Then that becomes the second dose. This is again one more practical difficulty in administration.
Another funny thing is, I would like to just ask whoever that's present here in the webinar, how do we as homeopaths, how do we do? Each one of us.
Ma'am, I didn't get you.
We all homeopaths, I'm just asking, it's a funny thing, but I'm just asking, all homeopaths, how do we take our homeopathic medicines?
Ma'am, I usually take only 5 pills. That is all once. If only 3 enter into my mouth, also I just don't take that again. And in cases of acute conditions, like whenever I get severe headaches, I prefer taking the medicine with water.
So each person has got a different experience and gets stuck up to their particular results. You feel, okay, I'm getting this result, so let me stick to this method of mine. That's also interesting.
No, actually, to be frank, after giving on the patients, I understood that the water doses. Actually, there was one patient who was a maths lecturer. For him, whenever he gets the throat pain because of his hectic schedule, he comes and asks me directly, "Ma'am, you just give me in the water doses. I'm better with the water doses, and instantly I feel relief." So for him, to give a medicine is just to give the medicine in the water dose.
So we can, on trial basis, if you really want to check, most of us can try this. In acute cases, should we give it by water result better, or is the pill result better? We'll have to try, OPD basis and judge for ourselves.
When we give our water doses, what happens is the potency increases, it deviates and increases a little bit. When we would just give 200 TDS, it would remain only 200 all the times. But when we give in water and give the succussion strokes, then it goes to, let's say, a little more. We could not give 100 strokes, so we can't say it is a centesimal scale, but at least 10 strokes would shift it up in the decimal scale. And that is why, as Dr. Hanneman says, that if the earlier the later potency is little more. The action that we get out of the medicine is much more. But if it is the same potency, the action would reduce. So in acute cases, it is advisable that we give it in water so we can give more doses with slight increase.
So I think many people do that, like that, then half a teaspoon or 1 teaspoon, like 1 hour, 2 hour, like that most people do.
Yeah, yes, ma'am. And whenever we stir the medicine, no, we add extra energy to the already existing medicine. And people usually have a habit of stirring and taking it. So that is like the potency is enhanced when they repeat the dose with the higher potencies.
That's what Dr. Vaishali was saying.
Yeah, exactly.
Thank you.
Thank you, ma'am. Thank you. Thank you for your valuable suggestions also, Dr. Vaishali and Dr. Vaijayanti.
I mean, because there's a big platform, it's interesting to discuss, and this is what and matter number of experience years.
Yes, ma'am. Yes.
This is very nice discussion actually going on about the potencies, because this is the most controversial thing, because everyone has a different way of administering medicines. Some give it in water and some exactly like the tongue dose, they directly take it on the tongue. So everyone has different experiences, so this is something which needs further discussions, the posology thing.
And on this platform, I mean, there can be unadulterated discussions, because we don't want to hide anything, or we don't want to make over things and discuss it. Whatever is there in our head, we need to know, because this is for, as I said, homeopathy.
Exactly.
Yes, exactly. There's nothing like feeling shy in sharing what I experience from with the others, and I can learn a lot of things from the others' experiences. So it's better that whatever I have in my mind, I have spoken out, and I'm ready to learn from the others, from their experiences, a lot of things.
Yeah, I think this is the only way to grow. We learn and then we grow together.
Yes, exactly. Yes.
Most of them can take up, one by one, a chance to speak in webinars, because that will also increase experience.
Yeah.
Whatever it is, the sharing is important.
I think
Yes,
we
ma'am,
still
exactly.
have questions. Alka ma'am, you can continue.
What did you tell the patient who wanted to drink
We
alcohol?
have run 20 minutes beyond.
Ma'am, I told him directly that the medicine what we give is more stronger than the alcohol what you are taking.
See, when they ask me this, I tell them that our action gets spoiled because of alcohol. So if you take alcohol, you would increase the span of treatment, and that is because of you. Otherwise, homeopathy works very fast.
No, ma'am, I usually tell them the percentage of alcohol what you take is just either 20 or 30. What we give is 90%.
Okay.
So you need not go with the other alcohol. That's
But
what I
you
usually
fear the medicine being antidoted by alcohol because it has the action on the nerves. It's an antidote.
Yes, ma'am, exactly. It is an antidote, but we can't just directly tell them the same things. No, even if we tell, they just counter for that. So for which I usually tell them that our medicine is more stronger. We give 90% of alcohol. So,
Okay, so is there anyone else who would ask the last minute question just before we end our session? If there's anyone, Dr. Kalpavalli is there to answer all our queries. Yes. I think some of them have left, the ones who were to ask questions. As I'll put it in the page also, in case anybody has any further questions, you can put it in our group, and I'm sure Dr. Kalpavalli can address you all later also. Okay, so thanks a lot, Dr. Kalpavalli. Your session was really very interesting. We have learned a lot, and it was a beautiful discussion at the end. Yes, thank you, Dr. Vaishali Pede and Dr. Vaijayanti Takarkar, for the active participation, even Dr. Raksha. Yes, so we hope
Thank you so much. The best was the Jugalbandi between Dr. Kalpavalli and Dr. Vaijayanti and the bombardment of questions. Chalo, bolo. That was fantastic, and water dose is usually benefited because it increases the surface area, so absorption also increases. So many people prefer water dose rather than pills. और जो है LM potency is useful in case of skin diseases. Okay, when you want to avoid Minimensor's life. He had introduced this, the advent of LM potency to avoid unnecessary aggravation. Okay?
Yes, ma'am.
Thank you
Yes.
so much.
Thank
And
you.
So much,
we are
Dr.
awaiting for more great insights into organon as well as other case implementation material medica this entire week. Thank you so much.
Thank you, ma'am. Thank you. Thank you so much. Thank you, Dr. Alka. Thank
All
you,
best
Dr.
wishes.
Umesh.
Dr. Alka, give yourself some credit. We are all thankful every time, each and every time you do this great work for us, getting us all together. Thank you so much.
It is always a pleasure. We belong to the same family and fraternity, Dr. Vaishali.
Yes, we're very thankful.
Thank you. Thank you so
I'll be
much.
happy to meet you all once again. And Dr. Kalpavalli, you have done a great job. We need to learn a lot more from you. And I'm sure because now that everyone knows you, anytime we have difficulties in the future, you are there for us and for the whole.
Thank you. It's my pleasure to answer whatever that I can. That makes me even study more with the organon, and I'll be a good learner. That time I'll become a good student and then read more to answer your questions. Thanks for the opportunity that you all have given me. Thanks to each and everyone in this particular group who have encouraged me, and immediately when I have posted, they have agreed that I can present in it. And forgive me if I have gone anywhere wrong, or if I have hurt somebody because of the words that might have used. Forgive me, but I thank you so much for all the patience that you have given me in my talk, in my expression. Thank you so much. Thanks one and all.
Thank you, Dr. Kalpavalli, and thank you all for attending the session and being patient and hearing everything. We are going to continue with the series. Yes, we are going to post about the different lectures and the different speakers who are going to present till 9th. So be ready for a new lecture coming soon. Yeah. So good night. As of now, we'll be meeting for the next session. Thank you, everybody. Bye bye.
Thank you.
Bye-bye.
Thank you, everyone.
Thank you.
Very nice discussion and session.